Hello po and magandang hapon. It's a wonderful afternoon today kasi po we are going to be celebrating World Obesity Day and discussing something that's really important ngayon po, which is obesity and the management po of your weight. So today, we are happy to be with one of the most distinguished endocrinologists in the Philippines and ipapakilala ko po siya later. So my name, I'm Dr. Anna York Bondoc. Our program is called Libreng Consulta. I am a internist, a pulmonologist, and a critical care specialist. I'm also the wife of Mayor J and the mom of an 8-year-old named Benjamin. So today po, World Obesity Day was celebrated last March 4. And I saw po her post and I said, it's time for us to talk about something other than COVID, which is also super important po ngayon. And that is your weight and how to manage it. So today, ang topic po natin is weight loss diets, the real truth. Okay, real na truth pa, but kailangan ho nating malaman lahat ito. And we are joined by one of the most eminent endocrinologists in the Philippines. I'm also proud to say that she's my classmate and one of the smartest po talaga sa batch namin. She is a US trained endocrinologist. She's a specialist in diabetes and metabolism. She is the chairman of the section Asian Hospital Section of Endocrinology and the head of St. Luke's Global Weight Intervention and Nutrition section. So we are very honored to have with us one of the most famous endocrinologists, one of the most mabait, and one of the prettiest, Dr. Joy Castillo Fontanilla. Joy, thank you very much at pinaunlakan mo kami ng oras mo.
Nako, thank you, Dr. Anna, for inviting me. Sobrang galing mag-introduce talaga ng friend. Thank you
Hindi,
very much.
totoo lahat yan. So, Joy, we're so interested to know more and talagang personally kailangan namin to, the truth about weight loss diets. So, sige Joy, please educate us.
Okay, so let me share my screen. It's really a pleasure for me to talk to you today about weight loss diets. Do you see it na? Do you see the screen?
Yes.
Okay, all right. So thank you very much, Anna, for inviting me. I love talking about weight loss diets because it really is a very important part of weight management. Our people, people with obesity are really struggling a lot with their weight journey. So we'd really like to help them. So for this afternoon, we'll define what fad diets are all about, and we'll also learn a little bit about how to spot bad dietary advice, and go on to talk about the best advice for healthy eating. So gaining weight is very easy. In fact, if you took like one extra Mentos in a day that you don't really need, no, if you take 10, one extra Mentos is 10 extra calories a day. If you do that, you'll gain about 1 pound a year. And if you take one can of soda or one can of soft drinks, which is about 140 extra calories a day, you'll gain approximately 15 pounds of weight in a year. And we know that keeping the weight off is very hard. In fact, losing weight is easier, but keeping it off is very hard. Only about 20% of the general population is able to succeed at weight loss maintenance. Now, a lot of people lose weight, gain it all back, and many of them gain it a vengeance. No, they even gain more weight than what they started out with. At saka ang daming diet, no? There's so many diets out there, from A to Z. This is not even an exhaustive list. Ang dami talaga. There's so many diets, the Atkins, the detox diet, the HCG diet, South Beach diet, etc. There's so many diets, but we can't really, cover all of them. But in general, how to spot a fad diet. These are the diets that tell you, hey, you're going to lose weight very quickly. You're going to fix your weight. It's a miracle diet. You don't have to exercise, things like that. So how do we define what a fad diet is? So a fad diet is generally a very restrictive diet which concentrates on just a few foods in an unusual combination for a short period of time and often promise you that you're going to lose weight very, very quickly. But unfortunately, once you get off the diet, because these diets can become very, very boring and very hard to stick to, people do gain a whole lot of weight, even more than when they started out with. So this is an example of a very restrictive diet called the cabbage soup diet, where people drink cabbage soup 2 to 3 times a day. All right, and then there's a strict menu from day 1 to day 7. So these diets can be very, very restrictive and quite boring. And there's the grapefruit diet, which makes you cut back on sugar and carbs and avoid foods like celery and onion, and make you eat grapefruit or drink grapefruit juice before or with every meal. Now we know that grapefruits actually do interact with medications. So if you take medications for cholesterol or blood pressure, they can cause the levels of your blood pressure medicine and cholesterol medicine to go too high. So the breakdown of these medications are impaired because you're taking a lot of these grapefruits and grapefruit juices. And there's the blood type diet, where you have to eat only certain foods depending what your blood type is. And this has really been debunked already. There's so many. There's been studies that show that it works whatever your blood type is, because you're actually restricting the amount of calories that you're taking in. So it doesn't have really any scientific basis for existence. So what's wrong with these fad diets? If you go on these fad diets that restrict whole food groups, you can have nutrient deficiencies. You can lack vitamins and minerals, and that can be very dangerous to your health. They can be very, very strict, very rigid, very boring. If you're eating grapefruit every single day or eating cabbages every single day, and so it cannot be, sustained for a very long time, and it could be a waste of time and money, especially if these diets entail that you buy the supplements along with them. So how do you spot bad dietary advice? Basically, if it promises to be a magic bullet and you don't have to change your lifestyle, but just doing the diet to lose weight without exercise, and they promise that you will lose weight very rapidly, and they recommend these magical fat burning foods or some certain hidden ingredients in the foods, and they tell you to avoid or severely limit an entire food group, like stop eating all the carbs or stop eating all fat, or a particular staple food, and this and they want to substitute it with these expensive supplements like vitamins and minerals, and a lot of people who advocate some of these diets actually sell these supplements in their own centers or clinics. Okay, if it also promotes mainly just one type of food, like that cabbage soup diet I showed you, and there's even the diet that proposed just eating chocolates. Okay, in fact, that was an article that came out that somebody just made up a study on chocolates that makes you lose weight, and it actually got published in one of the journals. But it was actually made as a hoax to prove that you can publish anything in some journal just because you have money. All right, so there are a lot of fake journals out there and fake studies out there, particularly with diets. And bad dietary advice makes you avoid things like all cooked foods. So the raw food diet is one of them. And the thing about raw foods is that, yes, they can be healthier, but there are foods that are better or healthier when they are cooked. For example, tomatoes, if you cook them, you actually release more lycopene and you'll be able to absorb the lycopene much better if it's cooked, if the tomatoes are cooked. And these bad fad diets recommend foods only in particular combinations, and you have to eat for specific blood type. And they suggest that being overweight is related to your allergies or because you have a yeast infection. Some of these diets also suggest that you're being overweight. Makes recommends that you detox or avoid foods in certain combinations, but offer no evidence other than, oh, this celebrity did it, and this celebrity is endorsing this particular diet. But there are no clinical trials that prove it. And they have claims that they can survive without food or having just the liquid meals alone, which they sell out of their own centers. And they focus only on the appearance, on your appearance, rather than the health benefits. So it's for cosmetic reasons rather than your health. So if it comes with, selling products or supplements, recommending to eat non-food items. There are those that even recommend eating cotton wool, which is ridiculous. And make recommendations based on just one single study and not replicated anywhere else. And they have the diet that's recommended for everybody. It's not individualized, it's not personalized, it's not tailored to you. And it's based on some secret that the doctors are yet to discover. So basically, if it sounds too good to be true, it probably is. So let's go back a little bit to the basics. When you take carbohydrates, proteins, fats, and alcohol, how many calories are each of these components? So if you eat 1 gram of carbohydrate, that provides about 4 calories. Proteins are 4 calories per gram as well. Fat is more than double that. It's 9 calories per gram. And alcohol is more than your carbs and protein. If you take alcohol, it's 7 calories per gram. That's why it's so easy to gain weight. So you hear of people who have beer bellies, because alcohol does have a lot of calories. And if you look at these different types of foods, you can try to guess how many calories do these common foods or drinks have. So for a bowl of Japanese rice, a small bowl of Japanese rice, it's about 353 calories. And how about an average serving of French fries? It's about 610 calories. And if you have a double cheeseburger or a quarter pounder with cheese, it's about 750 calories, which is pretty much like half your caloric needs for a lot of people in just one day. And how about a one-piece chicken with rice and gravy? It's approximately 430 calories. And if you drink iced tea, so it's similar to a kind of soft drinks, about 132 calories. So it's easy, to really pile up on the pounds if you're not looking at or watching what you eat. And if you want to know how much exercise you need to do to burn off that average serving of French fries, so let's say the French fries is 610 calories, you're going to need to swim for like an hour and a half, or walk for about 3 hours, or run for 1 hour, or bike for 2 hours, or do singles tennis for about an hour. Right? So that's why it's so hard to lose weight. And we have to take a look at sugar as well. Okay, how much sugar is in our drinks? And it's really surprising that a lot of the drinks that we have out there have lots of sugar in them. So if you look at this water drink, and it says it's vitamin water, you think it's so healthy, it's vitamin water, but it actually contains 8 teaspoons of sugar. And this bottle of soft drinks contains over 19 teaspoons of sugar, right? This popular sports drink contains 8.5 teaspoons of sugar. A bottle of iced tea, 10.5 teaspoons of sugar. So it's not surprising that a lot of our young people are starting to get diabetes with all these excess calories that they're taking in. And this is another very, very popular drink, the bubble tea. And it would be very, very surprising to know that uh, one serving of this bubble tea actually has double the sugar of your regular soft drinks. It's 20.5 teaspoons of sugar for a glass of bubble milk tea. Now, the diets that are out there, the most popular would be, the low carb and the low fat diets. All right, but this is also the most crazy discussion. No? The low carb advocates and the low fat advocates, if you look at their discussions online or even in journal articles, it can be very, very frenzied, and they can be heated. The arguments can be so heated between the two camps. Right. So the low carb camp versus the low fat camp. The low carb on the left, right, is one of the popular advocates is also a doctor, Dr. Atkins, and among the low fat advocates, Dr. Neil Barnard, and among them also Dean Ornish, who was the cardiologist of President Clinton, right, who prescribed him a low fat diet. All right, so there are so many advocates, and there are physicians among them for the low carb and the low fat diets. The low carb advocates say, oh, there's an advantage to going low carb because if you eat a lot of carbs, you actually produce a lot of insulin, which makes you deposit the carbs as fat, which causes you to gain more weight. And so if you reduce the carbs, you're actually going to lose more weight than if you go on a low fat diet. The low fat diet advocates actually often advocate whole food, plant based diets, low glycemic index. So processed foods are out. They are advocates of vegetables, a lot of vegetables, limiting animal products in the diet. And they have celebrity endorsers as well. I'm sure you know these celebrities for both the low carb and the low fat diets. So who's right and who's wrong? Unfortunately, whatever diet you go on, it can have its drawbacks. All right. So for the ketogenic diet, which is a super, super low carb diet, in general, it's less than 50 grams of carbs a day. Some even advocate less than 20 grams of carbohydrates a day. The ketogenic diet has been around for like several decades now. It's been around since the 1920s, and we prescribe that a lot because we had kids with epilepsy or seizures, and we didn't have enough seizure medications at that time, and it seemed to work for seizures. All right. So for those people, we have seen the long-term effects of the ketogenic diet. So long term, you can see things like kidney damage or kidney stones because they've got high urinary calcium, low urine citrate, and it can change the bacteria in your gut into a not so healthy combination. And this change in the gut bacteria actually may promote diabetes and hypertension and obesity, and changes in your blood levels of your blood sugar, blood acid levels, potassium, vitamins, and minerals can also be very low on these kinds of diet. You can long-term have heart problems. There are reports of dilated cardiomyopathy wherein the heart gets bigger, problems with heart rhythm, and stiff arteries. You can have fatty liver and end up in liver toxicity, gallstones, and pancreatitis. You can also have loss of your minerals in your bones and cause osteoporosis, leg cramps as well. And commonly, people on a ketogenic diet, because the carbs are super, super low and the fat levels super, super high, um, they have a keto. They have what they call a keto flu, where they have signs that are similar to the flu: fatigue, headache, fever, and they complain of brain fog. So there's impairment in the cognitive thinking, and they can also have bad breath as a result of the ketogenic diet. Now, the whole food plant-based diet advocates claim that it's going to make you feel full, because if you look at oils, fats, which are very common in the high-fat, low-carb diets, it'll take up this much in your stomach. But if you take lots of fruits and vegetables for the same amount of calories, you're actually gonna get, fill up your stomach, and you're gonna feel full and satisfied that way. So why do people who are vegetarians gain weight? Why do they gain weight? It's probably because they're not really choosing the caloric density or the foods that have less calories in them. All right. So those whole food plant-based advocates tell you to eat to the left of the red line. So to the left of the red line means eating foods that are lower in calories, or less dense in calories. So like vegetables and fruits and unprocessed carbohydrates and legumes. So those are your beans, peas, lentils, chickpeas, right? Instead of eating meat and oil and junk foods and sugars. Now, who's right and who's wrong? There's so many diets out there. So there have been studies that looked at all these diets and compared them. So this is just one of those studies which compared the Atkins diet, which is the representative for the low carb, and the Ornish diet, which is the representative for the low fat diet. And then there's the Weight Watchers, which is just restriction of calories, and the Zone diet, which has a specific percentage of carbohydrates, protein, and fat. So it's like 40% carbohydrates, 30% protein, 30% fat. All right. And it basically showed now in this particular study that all of the patients who went on these diets, all of the patients lost weight. Okay, so all of the diets worked if you stuck to them. All right. So there are a lot of people who were not able to stick to them, and those people did not lose weight. All right. So it was really increased adherence or sticking to the diet that mattered. This was associated with greater weight loss and greater reduction in the risk factors like cholesterol levels, sugar levels, blood pressure levels, etc. Okay, so if you're able to stick to the diet, then you lose weight, and all of them work, right? As long as you stick to it. So basically, calories do count, but sticking to the meal plan counts even more. Now, are all calories equal? We already know that the proteins, fats, and carbohydrates have different amounts of calories in them. All right, but if you had the same amount of calories, and you restrict the same amount of calories, are going to lose weight regardless. And there are studies that show that whatever diet you're on, you're going to lose weight as long as you restrict the calories. But what about nutrient quality? No? What about the quality of your calories? Well, this particular study showed that if you ate an animal derived protein and fat, if your sources of protein and fat are from animals, then there was an increase in death rates. But if you ate more plant-based foods like vegetables, nuts, whole grain breads, um, they saw that in these 432,000 people that there was less death, um, lower death rates in those people who ate plant-based sources versus animal-based sources. So there are different ways to go low carbs. If you want to go low carb and low carb works for you, either you reduce your amount of high carb foods or you increase the amount of low carb foods, right? And if you compare the two, these have exactly the same amount of carbohydrates. But if you look at the plates, you can get really full with eating foods that are low carb and healthier, because they are plant-based. So with food, quality and quantity do matter, right? So it's not just about weight. Now we look at also, how's your cholesterol, how's your blood pressure, how's your blood sugar, and will it help you live longer? Now, for a lot of people, like Garfield here, diet is a dirty four-letter word. Well, it doesn't have to be. So some people think diet is just a word. Diet is a word that you spell die with a letter T. Okay, and they feel like they want to die when they're on a diet. So there are those advocates that say, then don't go on a diet. Just eat mindfully. All right. So eating mindfully means listening to your body's hunger cues. Each time you eat, you pay attention to how you're eating. Don't be distracted. So this person on the left here is someone who's eating mindlessly, very distracted, who's eating while she's at work. Okay? We do that a lot when we're watching movies or watching, K-dramas on Netflix for long periods of time, and we're just munching on food. So eat mindfully means, pay attention to the activity of eating. Pay attention to the texture of the food, the smell, the sight, etc. And just really, really enjoying what you're eating and listening to your body. Am I still hungry? And you stop when your body feels that it's full. So some basic tips, keep a diary. Okay? People who keep a diary, a food diary, and write down everything they eat, they tend to be more successful with their weight loss. And be aware of the habits and the problem areas. What are the trigger areas? What kinds of situations trigger you to eat? So, because some people do emotional eating, some people do stress eating. Right? So there are things that you can do to keep, food away. Stay away from the pantry, stay away from where the food is kept, or really hide the food so that it's not readily accessible to you. And have regular meals, starting with breakfast, including protein with each meal, because protein actually helps you feel full. Um, More than any of the other nutrients, protein makes you feel full, satiated compared to the other calorie sources. And choose healthier choices. So if you want to go low fat, instead of drinking full cream milk, drink low fat milk. Or if you want to take meat, choose the leaner cuts of meat rather than the taba, the fatty cuts of meat. And make sure it's balanced and there's a variety of food that you're eating. And fill up on vegetables and fruit instead of desserts and processed sweets. So do watch your portion sizes, get active, walk at least 30 minutes a day. For weight loss, try to gear up to 60 minutes a day and be realistic about it. You don't need to aim for a 10-pound weight loss in 1 week. Just aim to lose 1 to 2 pounds a week. All right. And make sure you see your doctor first to make sure that you're okay to do a lot of vigorous physical activity. Now, there's another very interesting topic. It's about meal timing. And it seems that with food, timing is everything. That when you eat matters as well. What you eat matters, but when you eat matters too. Okay. So if you eat your calories towards the early part of the day, they've shown that people do get better blood sugars, blood pressure, and better cholesterol levels, and do tend to lose weight when they do that compared to those people who eat late at night. This is one of those dietary approaches that look at time. I'm sure you've heard about it, intermittent fasting. But there are different ways of doing intermittent fasting. There's the alternate day fasting, wherein you would eat normally one day, and then the next day you would fast. You would eat less than 25% of your calories in the day, or just not take any food at all. Right? And then there's the alternate day modified fast, where you eat normally one day, then the next day you would eat just 1/4 of what you normally would eat. And then there's the 5-2 diet, where 2 days of the week, non-consecutive days, you would eat only 25% of your usual calories and eat normally the rest of the week. And then there's the fasting mimicking diet, where you would eat only 25% of your normal intake for 5 days, and 2 days wherein you would eat regularly. But most people do the time restricted feeding, wherein they would eat only within a certain time period of the day, whether it's 6 hours or 8 hours in a day, and fast for the rest of the time. So some people will eat, like this, let's say between 8 a.m. and 4 p.m. or 10 a.m. and 6 p.m. That's what we call time restricted feeding or time restricted eating. And those studies looking at that have shown that if you eat late, you generally do gain weight. So people who eat their main meal of the day after 3:30 do tend to gain more weight than those who don't, those who eat their calories early on in the day. And for those who are able to restrict the amount of time that they eat, seem to do pretty well, all right, if you can stick to it. But it does have its challenges. It's very hard also to eat only from, let's say, 8 a.m. to 4 p.m. or 10 a.m. to 6 p.m., especially since a lot of occasions for eating happen at night. And here's another popular adage that seems to be true, that if you eat breakfast like a king, lunch like a prince, and dinner like a pauper, it's better for your health. So eat a large breakfast, medium lunch, and small dinner to help with your blood sugar, your cholesterol, and for your weight in general. Now, your genes are also very, very important. It seems that there are some people who do well with low-fat diets, and there are some people who do better with low-carb diets. And we're moving, science and technology is moving with nutrigenetics and nutrigenomics, but we're not there yet. But in time, you might have what we call precision nutrition, wherein if you just find out what this person's genetic makeup, then you will know what diet will fit this particular person. But these are all still being researched, and very exciting field to get into. But we're not there. We're not quite there yet. So if you want to live long, eat like an Okinawan. Now, Okinawa is in Japan, and most of the people who live 100 years old and over, the centenarians, the biggest concentration of centenarians in the world live in Okinawa. Okay, and people have done research on these Okinawans. Why are they living so long? And part of it seems to be their dietary lifestyle, particularly the diet. So they're looking at what they ate, and mostly what they ate was plant-based. So 70%, there's like sweet potatoes and vegetables, and minimal use of oils, and they probably have meat once a week only. And another interesting thing about the Okinawans, they eat only until they are 80% full. So when they're 80% full, they stop eating. So if you want to live to be 100 years old, eat like that. But one thing we know about weight loss diets, there is, one diet really does not fit all. We really have to tailor the diet and make it specific to each and every person. So when we prescribe a diet, we look at the overall, the patient overall, what are their blood pressures, or cholesterol, or other comorbidities, what are their medications, what is their lifestyle, etc. So we can design a diet that's really fit for them. So thank you very much for your attention. And I'd be very, very glad to answer your question.
Much for that. Thank you so much for that truth about diet. Nalungkot lang ako. Parang mali yata yung mga diet ko. Every time I hear this, I just get depressed. But may hope pa naman, I hope. Oo. So sige, let's flash a few. Ang dami nagtanong eh.
Okay.
Let's flash a few questions. Ako, ang tatanong ko, parang dumadami yung mga overweight kids. How do you deal with that? Lalo na kung bata pa. And then, medyo conscious pa sa katawan nila. And then, the parents, pag sinabihan mong mataba yung anak nila, hindi na sila babalik. How do you handle that?
Okay. Well, I'm not a pediatrician, no? But
but yung mga teens, gano'n, oo.
Yeah. So in general, for children and adolescents, you really have to get the whole family involved. It's a family-based approach to weight management when it comes to children and adolescents, because it's the adults that prepare the food for them. So we have to really get everybody involved. And the thing with weight management, you have to see also a person's readiness for change. You really can't force them to do everything. Pilitin talaga. Kailangan manggaling sa kanila. What we can do is share na, okay, ito yung mga pwedeng mangyari kung hindi natin pababain yung timbang mo. Kasi
pero kailangan galing din sa kanila. We cannot drag them towards a diet.
You can educate ano yung consequences, and then eventually they do come around.
Pag natakot na. Yun. Miss Rains, would you mind reading the questions? Kasi matanda na ako, hindi ko na mabasa.
From Mr. Nino Mauricio, ilan po ba ang preferred na calorie intake in a day?
Okay. So basically, kung gusto po natin mag-lose ng weight, no, it depends on what your body weight is, no? Kung ano yung BMI mo. So BMI is your weight in kilograms divided by your height in meters squared. Maraming BMI calculator online, so you can just see what you are. Ang normal BMI po for Filipinos is less than 23. So if you're at a normal weight and you just want to maintain your weight, it's about 25 to 30 calories per kilogram body weight. So if you're 50 kilos, then 30 calories times 50, that's 1,500 calories of food that you can take in per day if you want to just maintain the weight. But if you want to lose weight, okay, so in general, rule of thumb for men, mga between 15 to 1,800 calories ang ililimit natin. For women, between 12 to 1,500 calories if you want to lose weight. So in general, if you want to lose siguro 1 pound a week, that's why it's so hard to lose weight. Kasi 1 pound, to lose just 1 pound of fat, you have to burn 3,500 calories. That's just to lose 1 pound of fat. So if you want to lose 1 pound a week, you cut off 500 calories a day or try to burn 500 calories a day. Kaya maganda kung i-combine mo with exercise. So reduce yung food intake. All right. But the quickest way if you want to lose weight is really to do it through the diet. As it's really been shown, if you compare diet versus exercise, it's much harder to lose weight when you just do exercise alone without watching your diet.
Ayan.
Our
So,
next
parang
question.
Miss Reina, please. Parang marami akong nakikitang tanong. Tama ba ako?
Yes po. Our next question would be, please comment sa keto. Usong-uso po ngayon.
Yes, ang dami nakikito, no? All right. So, a keto is a very, very low carbohydrate diet. I do have some patients on keto kasi ito lang yung nag-work para sa kanila. But definitely, when you're on keto diet, pinakita ko kanina yung mga possible complications. So we just have to monitor, lalo na yung mga vitamins and minerals and electrolytes, particularly yung potassium, pwedeng bumagsak kasi on a ketogenic diet. So we have to monitor these as well. And because the ketogenic is very, very high in fat. So you have to watch that din. Kasi long term, pag masyado pong mataas yung taba na kinakain natin, lalo na if it's from animal sources like lechon, fat, beef and pork, then long term kasi yung effect naman sa heart.
Baka bumara din yung puso mo.
Yes. So, pwede mag-heart attack. So if you want to eat, we choose the healthier kinds of fat. So healthier sources of fat like olive oil, fatty fish like salmon, tuna. So we try to substitute for the healthier, if you really want to do the ketogenic diet. And dapat talaga nang monitor. Hindi pwedeng gagawin mo siya by itself, by yourself lang. There was a case report of one of the worst cases of a ketogenic diet. There's a 16-year-old girl who did it on her own. Ginawa niya, nag-low carb siya, etc. But she ended up in the emergency room and she died eventually.
Oh my God.
Yeah, kasi super bumagsak yung potassium level. So it can be dangerous for some people. So we do need to monitor if you have somebody on a ketogenic diet.
How long can you do a keto diet na safe? Kasi may nagsabing masama daw pag masyadong matagal.
Mm-hmm. The expert recommendations are to not make it go beyond 3 months. Right. But I know of people who've been on it for years and years and they're fine.
Ano kung kumakain sila ng steak araw-araw and bacon?
Yeah, so, well, all sorts of things. There's some who are not as as unhealthy as that. No? They do choose their protein and meats, so less animal fat.
Pwede naman na matagalan din.
So may
Kaya
mga
dapat piliin kung ano.
Yes. So that's what I said. It's not just the quality, but the quantity, but the quality also of the nutrients that you take in. So there are those that go ketotarian, so keto siya, pero they fill up on the low carb vegetables.
So, meron din.
Yes.
Question, yung Cohen, kasi may pasyente ako who lost 90 pounds on Cohen. Is that a keto diet? Pero parang nanghina daw sila ng sobra.
Well, Cohen is basically a calorie-restricted diet. So,
Okay.
in general, below 1,000 calories siya per day.
Parang daw, she felt like she was starving.
Kasi very low calorie siya.
Oo.
So,
Pero
anything that, as
payat
long as
naman. Oo.
yes, as long as you restrict the calories, it'll work talaga.
Oo.
Any diet that restricts calories will work.
It will work. Kaya lang, yung maintenance ang tanong.
Yes. Yung long term. Ang gusto sana natin is, what kinds of changes someone can do for his or her whole life. For some,
Hindi naman
just
pwede
cutting
forever.
out soft drinks. I've had patients na ganyan. Tinanggal lang yung soft drinks, they lost a lot of weight na kasi they were chugging down soft drinks 2-3 liters a day.
So, yun pala ang malaking bagay na. Okay. Parang ang dami nating tanong. Miss Reyna, marami ba?
Yes, Doc, marami po. Another question is,
Siguro,
I think,
excuse me lang. Palimit lang muna natin. Dr. Joy, ang dami atang tanong. So, short na lang daw, sabi ni nung moderator natin.
Okay.
Yeah.
Okay. Okay. Is IF helpful? I think this is intermittent fasting po.
Yes, intermittent fasting. So I did show kanina different ways of doing intermittent fasting. So meron naman, may mga studies na nagpakita na if you compare intermittent fasting with a calorie-restricted diet, some of them do work, do as well as a calorie-restricted diet. Because if you eat only a certain time period of the day, you tend to eat less calories na. And in fact, if you do the time-restricted feeding where you eat earlier on in the day, yung 8-2 diet or 8-4 diet was better than if you ate later on in the day. You had your calories later on in the day. So meron namang benefits ang intermittent fasting. Yun nga lang, kung ikaw ay merong ulcers or yung parang hyperacidity, or kung may mga gamot ka katulad ng insulin or sulfonylureas na nakakababa ng blood sugar, it might be dangerous for you. So you have to talk to your doctor about it and how you're going to adjust your medications if you really want to try the intermittent fasting approach.
Kasi kailangan may adjust mo yung insulin mo and things like that. Kasi baka hindi ka na kumakain, nag-i-inject ka pa rin. So, yun. Okay. Marami nag-IF yun lang. Next question.
From one of our viewers, can diabetics be I think the diabetic person can be vaccinated for COVID?
Siguro alam nilang endocrinologist si Dr. Joy, kaya tinanong na nila to. And one of the foremost diabetologists sa bansa. Joy, inuulan ako ng tanong na to every time. Pwede bang binibigay pa nila yung FBS nila eh. So, pwede ba silang mabakunahan? I feel yes, but I want to hear it from you.
Well, absolutely. For me, absolutely yes, you can be vaccinated. In fact, di ba, we recommend vaccination for flu, for pneumonia, for people with diabetes. Kasi nga, high risk. High risk ang mga taong with diabetes. For COVID, for a lot of infections. So, once you get the vaccines in your area, try to get vaccinated as soon as possible. Yung mga tao lang talagang kailangan mag-ingat, yung mga may allergy. So if you're allergic to a vaccine, you've been allergic to a vaccine or to any component of that particular vaccine, yun po yung mga kailangan talagang bantayan. And probably will not be a candidate for vaccination if you have severe allergic reaction to a previous vaccine or that particular vaccine. Yun lang yung hindi dapat.
Question, bakit binibigay pa ng mga tao yung FBS nila at pag mataas daw, ayaw na nila magpabakuna? May issue ba yon na kung mataas yung FBS mo?
It's not much of an issue. Well, in some people say na pag nag-inject kasi tapos you have an adverse reaction, pwedeng tumaas yung blood sugar mo. Pero madali namang makorect yun. So So adjust lang
Okay.
yung
So,
nutrition,
even if
monitor
mataas, for purely controlled diabetic, pwede pa rin mabakunahan.
pa rin. Yung mga kailangan mag-ingat lang, at siguro kailangan na clearance ng doctor nila, yung mga mga kidney transplant, yung mga na-transplant na may mga immunosuppressant
Okay.
medication.
Oo.
Oo. So, kasi
But
may mga
other
studies
than that,
nakita
okay.
na hindi masyadong effective yung vaccine for them.
Okay. Okay. Thanks, Joy. At least now I know, dapat sila mabakunahan.
Yes, as much as
From
possible.
one of her, okay, another question po from one of our viewer. Paano po yung mud wraps ng Marie France? O nga no, doktora.
Kasi yung binabalutan ka na malamig eh. Meron bang ganon?
Okay.
Yung
So,
nanay ko nabalutan dati, it didn't work.
alright. Well, ang rationale nila kasi, well, cold in general makes you produce more brown fat. No? Meron tayong iba-ibang klaseng fat sa katawan natin. So yung brown fat, yun yung meron tayo ng babies tayo eh. Brown fat turns to burn more calories compared to white fat, which what most of us have. Pero yung mga cold wraps na yan, if you're not controlling your diet, you're not exercising, you're probably not gonna lose weight through that. It's not gonna be that effective.
Not good. Yung nanay ko nabalutan, nothing happened. That I can tell you. Kasama pa ako doon. I was there. Tapos binabalot nila sa malamig, tapos pinagbabalot-balot. Nothing happened. So she looked like a mommy. Nagalit lang siya doon sa nagbabalot kasi nalamigan siya. Okay, next question.
From Miss Mina Sabado. Also, what about keto diets? I think she wanted to elaborate about it more po.
Parang
Okay.
pasyente mo ata si Mina Joy.
Okay.
Kasi
Sige.
binati
So
siya
I
kanina.
mentioned earlier about the keto diets now that it can have complications because keto diets have been designed specifically for people with epilepsy or seizure disorders. Now we prescribe keto diets basically for that. Okay. So I know a lot of people do try the keto diets. They're very, very low in carbs, less than 50 grams for most, or sometimes less than 20 grams. Ngayon, if you go keto, we do have to monitor quite closely, especially yung potassium levels, no? Kasi pwedeng bumagsak. And people on keto diets tend to be low also in other vitamins and minerals. In long term, yun nga, like I said on the slides that I showed, you can have problems sa kidney, sa heart, sa liver, lalo na yung fatty liver. Kasi nga, daming fat na kinakain. Usually, on a keto diet, it's approximately 70-80% fat. Eh.
Wow.
So,
ang dami. I didn't know that. Oo.
It's that high. So, we have to watch people on keto diet and preferably sana yung fats na iti-take nila, yung healthier fats, not the unhealthy saturated fats.
Okay. So, depende rin sa klase ng fat na kakainin mo. Yes. Miss Rains, pakibasa lang.
Yes, from one of our viewers, any comments on Scarsdale?
Ay, ako, mas Scarsdale. Sige, Joy, let us know. Maganda ba yon?
Well, any diet naman talaga works, no? As long as it restricts the calories. And if you can stick to it. All these...
Parang older diet ata yung Scarsdale.
Any there's so many diets out there. They're named after the people who make them or the places they were made, etc. So as long as the calories are restricted, then
Pwede
they do
na.
work. We just have to watch out then, kasi all these diets can have side effects and complications. So for the keto, yung pinakita ko earlier. For those on very low fat diets and purely vegetarian or vegan diets, we do have to make sure that they supplement with B12. Kasi yung vitamin B12, you can only get it from animal products or from fortified cereals. So patients on vegan diets, they may have to supplement with some vitamins kasi pwedeng mababa sa iodine o mababa sa vitamin D and calcium they go on those diets. So whatever diet it is, make sure you tell your doctor what you're eating and not eating, so that he or she can help you if you might have to be on a supplement if you're cutting out particular foods.
Okay, from one of our this is from Dr. Dodge, Silim Hoko. Wait lang po ah. How come when you are obese?
Dr. Dodge eh. Oo. Yung sa urologist, look, sir, kumusta kayo?
Yes, hi Dr. Dodge. How come when you're obese, you are more prone to kidney stone formation?
Kidney stone formation. Well, I know if you're obese, you do have more problems with the kidneys because of you can have, if you have fatty liver, you can also have fatty kidneys. And if you're obese, you also, may fatty kidneys. If you're obese, you also have more likely to have hypertension and high blood sugar, diabetes, and have kidney damage. About kidney stones, well, if you're obese, you also have what you call the metabolic syndrome. And people with the metabolic syndrome tend to have high uric acid levels. And with high uric acid levels, you can have problems with gout and uric acid stones in the kidneys. So those people are prone to having kidney of uric acid.
Yeah.
Okay, next question is...
Ako, 1 second. Joy, ano yung PCOS? Bakit parang uso siya, people keep saying they have PCOS and then they're chubby. Ano yun? I get a lot of questions about PCOS.
About PCOS, sorry?
Oo, parang they tend to be also chubby. Oo. Or parang may weight
PCOS or polycystic.
Ang dami nagsasabi ng mga medyo mabibigat na patients, may PCOS daw sila. Pero when you ask them kung formally na diagnose, hindi naman nila masabing oo. So hindi naman talaga.
So in general, polycystic ovarian syndrome is a pre-diabetic state.
Okay.
Pre-diabetic state siya. Ang problem is insulin resistance. So it's a precursor to diabetes. So people with PCOS do have very high risk of developing diabetes, and they also have high risk of developing the other components of the metabolic syndrome: high blood pressure, abnormal cholesterol levels, and heart problems with the heart. No? They can have higher risk for heart disease as well. So pag may PCOS, talaga kailangan bantayan din. Because so we also prescribe diets for them if they're overweight or obese. Generally lower glycemic index or lower in sugars, refined sugars, more vegetables, less saturated fat, more fiber.
So they may develop diabetes in the future. Yun, ang PCOS.
Yes,
pre-diabetic siya. Okay.
Yes.
All right. Sige, Miss Rains, next question.
Okay, next question. Help, tubig lang po. Tumataba ako. Pwede po ba yun?
Meron bang ganon, Joy? People keep telling me that.
Sorry, I can't understand. Is it...
Parang tubig lang daw, tumataba na siya.
Okay.
Meron bang ganon? Hindi naman siguro totoo yun. Pero merong parating nagsasabi nun eh. Basta tubig lang daw tumaba na siya.
Water weight. If you take too much water, you can have fluid retention.
Baka naman tinatago lang yung kinakain niya, Miss Reyna. Ako hindi naniniwalang may tumaba sa tubig, okay?
Walang calories. Unless they drink the vitamin water.
The vitamin water, yung sinabi nga. Natawa nga rin ako doon. nalungkot din ako sa milk tea dahil yung anak ko mahilig sa milk tea.
Grabe
Tapos
pala
yung sister-in-law ko pa naman owns Macau or a portion number of Macaus. So ano pala siya, maraming sugar. Paano kung humingi ka ng less sugar sa Macau milk tea or sa mga milk teas? Okay na ba yon or mataas pa rin?
Akong zero sugar. So much
Yeah,
better.
diba?
Much
So
better.
mag-request ng zero sugar sa mga milk tea. Okay, so alam ko na. So Miss Rains, something about being a vegan, Miss Reina?
Yes, from one of our viewer, is it healthier to be a vegan?
Okay, so ang vegan, okay, hindi po yung probinsya, no? So vegan is a purely vegetarian diet. So
Maganda ba
purely,
yun? Like, should we
purely
become vegetarian? Oo.
So, yeah, a lot of people who go vegan or more plant-based, um, a lot of the studies do show that plant-based diets help with blood sugar, cholesterol, also help with weight loss if you're overweight or obese. Yeah, so I mean, I have absolutely no problems if you want to go vegan. The only thing is we do have to watch for your vitamin B12 kasi pwedeng mababa yung vitamin B12 if you go vegan. And you have to learn how to eat the right way also if you're gonna go vegan. Protein sources mo kasi you can have incomplete proteins if you don't do it right as well. Okay. So you may have to supplement, especially vitamin B12 because B12 can only be taken from animal products. Or if you take fortified breakfast cereals. So there is also, a wrong way to do vegan. So people
Merong
who,
mali. Okay.
yes, yeah, especially those who just eat starches. Alam mo yun?
Like,
Kung panay,
puro potatoes na lang.
yeah, and don't have other sources of protein like tofu or legumes. So maganda sa vegan is you have a variety dapat. Iba-ibang kulay ng vegetables sa plate mo.
So, wag puro patatas. No. No.
Yes.
Okay.
Oo.
Yeah.
Hindi
Go
pwede
on.
patatas.
French fries na lang. Vegan plus keto. O, diba?
Ang
Hindi
vegan,
maganda.
di ba? But if you eat
Oo.
french fries 3 times a day, that's vegan. Pero hindi siya healthy.
Tama. Hindi rin maganda. Ito, magandang tanong to. Miss Reina, pakibasa lang.
From one of our viewers, okay lang po ba uminom ng Coke Zero?
Please say okay because I've been drinking that for 20 years.
So compared to regular soft drinks, definitely wala siyang sugar. So if you're
Okay.
trying to watch your sugar intake, yes, it is better. But is it a healthy drink overall? I would say not. Kasi marami siyang
Hindi.
chemical.
Marami
There are
siyang chemical.
so many other chemicals in it. And one of the chemicals in it, I forget the name. It has a very, very long name. It's found to possibly be carcinogenic or cause cancer. So if you want to, drink healthy water or tea, would be better than
Coke Zero. So, hindi siya better than Coke but still not good. Yan.
Yes.
Sige. Okay. Miss Rains, meron pa ba? Ito.
Okay, calories sa iced tea. Alright, so I did show that slide nga, no? So the regular iced tea, para ka lang umiinom ng soft drinks. Alright, so yung alam na yung mga powdered iced tea natin, so mataas yung sugar content. So better if you want to really make the iced tea on your own. Get a tea bag, dip it in warm water and then put ice in it to cool it.
Okay. So, iced tea, maraming asukal.
Yung commercial iced tea natin.
Commercial iced tea, yung tinitinda. What is more effective? Exercise or diet?
For weight loss, diet.
Or combination siguro, di ba?
Combination is still the best because if you want to, if you're aiming for long life, for your heart, etc., the benefits of both diet and exercise makukuha mo talaga. Kasi kung diet
Okay.
lang, hindi ka nag-exercise, di parang
Hindi
mapapabayaan mo
rin
rin
maganda.
yung heart mo and
Yan.
all the benefits of exercise
Please,
are lost. No, if
Siguro,
you don't.
ito,
yes.
maganda to. Please comment on the natural
Please,
sugars in baby foods. Is it okay? Kasi marami atang mga baby food na nakalagay, no artificial sugars, pero matamis pa rin.
Okay, so usually the natural sugars in baby foods are from fruits. So that should be okay.
Okay naman.
Feeding
Okay.
your babies fruits would be fantastic. Give them fruits and vegetables. Get them used to fruits and vegetables while they're young.
Ito, question. Hindi ko mabasa yung
from one
pangalan
of
niya.
our, from Miss, yes,
Sige, ikaw na.
I'll do it na lang, Victoria. From
Sige.
Miss Doris Esguera Cunanan, stevia po ba is good as sweetener?
Okay. So may mga sweeteners po tayo. So there's Splenda, there's stevia, there's equal, no? Iba-ibang klaseng sweetener. So stevia is from a plant. And if you want to lessen the amount of sugar you're taking it and you want to sweeten your drinks, stevia is an okay sweetener to use.
Ayan. Okay. Ma'am Doris, okay daw si stevia.
Yes, from one of our viewer, is juicing vegetables and fruits healthy? Nakabili po akong juicer kasi.
Okay.
So, isang bumili ng juice. Maganda bang magpa-juice? Maganda ba? I don't know.
I would prefer if you do the blenderized type of juicing. If your juicer is the one that just liquefies it and removes the fiber from the vegetables and fruits, you lose the benefits of fiber. And mas mabilis ma-absorb tuloy yung juice. And if you're juicing a lot of fruits, remember to make 1 glass of juice, you have to squeeze so many fruits, and then you'll end up with a lot of sugar in it. So if you're going to juice, better siguro if you use the blenders, no? Para nandun pa rin yung fiber. Okay, so fiber is very important. It helps reduce or delay the absorption of the carbohydrates and helps you cleanse your colon as well para hindi ka ma-constipate. So all of these better
Mas
to
maganda yung buo mong ilalagay yung fibers into the whole thing. Kasi meron iba crush lang, so that's not a good idea. Better na yung buo ilagay. So, yan. Para may fiber. Yan. I thought I saw another question. Yan.
From Mr. Jopoy Pandarawan. Is it true na once tumaba ka, mas madali ka nang tumaba dahil hindi na maaalis ang fat cells sa katawan mo?
May nagsabi niyan sa akin. Totoo ba yun? Sabi nila, fat cells never die.
Okay, that's not true. That's not true. Yeah, you can reduce the amount of fat through diet and exercise. Pero it's true na mahirap for some people, no? We have to remember that obesity is a disease, okay, and obesity can be linked to genetics, no? So if you're born from, if your parents are obese, you're more likely to be obese. Okay. So in genetics natin, unfortunately, we can't change our genes, but you can, be helped out. If diet and exercise don't work alone, we do have medications that can help you. And we do have other ways to help you lose weight if you're unable to do diet and exercise alone.
Yung mga medication na nauso few years back, na parang it will be hard for you to absorb fat, tapos yung dumi mo will become white or something like that. Uso pa ba yun?
So may mga supplements and medications. So there's Orlistat. What it does is it makes you not absorb like 30% of the fat that you take in.
Maganda pa ba yun? Yung early start na yun?
Siya.
No?
So you poop out 30% of the fat in your diet. So Orlistat is still around, and it's available also over the counter. There's another one. It's called polyglucosamine or formalin. What it does is it also binds the fat. It makes it into a gel, and then it just comes out with your poop as well, with your bowel movement. Pero hindi ka
Maganda ba siya? I mean, have you found it to be effective? Do you use it as frequently? Anong...
There, of course, like with any other medication or supplement, there are people who respond well. There are people who don't respond. So you can give it a try because it's not something that's dangerous. It's relatively safe. So these medication like the Orlistat and this polyglucosamine, it's relatively safe. So you can give it a try.
Okay naman to try. Oo. How about itong energy drinks na papayat ka daw? And I suspect may mga ephedrine or whatever dyan.
So there are a lot of these drinks out there. So you have to watch it kasi some of them have mega doses of caffeine in them.
Okay.
And some might have these banned products as well, like ephedra or if it's Chinese, if it has mahuang, that's basically ephedra. So these are basically shabu, similar to shabu, like shabu.
So don't be careful about these diet drinks kasi hindi natin alam kung ano talaga nakalagay dyan. Yeah.
Okay.
Parang
Okay po. Another question from Mr. Nick Sotelo Marquez. Pwede pa rin po ba mag-protein shake kahit breastfeeding para makalose ng weight? Question lang po, no hate. This is also my question, Dr. Joy, because I'm also a mom who breastfed.
Okay. Yeah, so breastfeeding is great kasi it will help you lose weight. Okay. Just make sure na when you want to lose weight and you're breastfeeding that you don't get malnourished from doing that. So if you want to go on a diet, lessen your calories. The protein shakes, I would be, a little bit worried. What are you putting in your protein shake? Is it a lot of chemicals or is it natural? Or I would prefer if you get it from natural foods, rather than chemicals that you put in your body, especially if you're breastfeeding. Kasi what you take in is gonna go to the baby also.
So dapat. Meron pa pala. From Paige, Miss Rains.
From Miss Paige Rihanna. Yung friend ko nagpapapayat, mabisa po ba ang kumakain ng lettuce and carrots? Good po ba result?
Siguro kung lettuce and carrots.
Naman, pero wag lang yun.
Papayat ka. Oo. Pero yun nga, if kung lettuce and carrots lang kakainin mo, magkukulang ka sa sustansya. So basically, limit, lessen the amount of calories. The easiest way to do it nga is imbis na gumamit ka ng malaking plato, yung platito, yun ang gagamitin mong plato, yung platito. Ganun karami lang kakain.
Malungkot naman yun. Make your plate smaller so that but don't go back 5 times kasi hindi rin naman nakakatulong yun. Okay. So, meron pa, maraming humahabol. Sige, Miss Rain.
From Miss Madonna Gal, is it safe to take plant-based hormone to look young and sexy? Hindi ko to alam. And what brand of plant-based hormone is safe?
Meron ba? I don't know.
Ang hormone.
Meron ba? Ano yan, Joy? Bibili ako mamaya.
Ang mga hormones po kailangan po talaga prescription medications yan. So kailangan po ginagabay po ng doktor. So there are people who sell these bioidentical hormones in their clinics. And I would
meron
please be very cautious. May mga pasyente ako na nagtitake ng mga ito, and lalo pa nasisira yung mga. So saying that it's It's safe because it's plant-based, for your thyroid, mga ganyan. Tapos pag chinek mo yung mga blood test nila, lalo pang sumama results
So be
nila.
cautious.
Be cautious,
Not
yes.
everything plant-based is safe. So be
Yes.
cautious.
Meron din naman plant-based poisons, di ba?
Oo
So,
nga. Tama
not
yun.
hindi lahat ng nasa gubat pwede mong kainin.
True. So I didn't know that na meron parang plant-based hormones na tinitinda. So be cautious. Be cautious. Yan. Ako, question, what about gluten-free? Usong-uso yun ngayon.
Okay. So gluten-free, well, for people who have celiac disease, who truly have gluten intolerance, yun kailangan talaga aalisin mo yung gluten sa kanila kasi masisira yung intestines nila. But for most people who can tolerate gluten,
It's okay.
It's okay. So yung gluten-free diets, alright. Well, some people use it for weight loss. Well, basically, kasi you're restricting the types of food that you're eating.
Ayan. So, okay, last na to.
From Miss
Healthy
Minus,
alternatives to sugar. I see a store selling sugar-free drinks with maltodextrin, dextrose, or
Maltodextrin.
aspartame. Okay ba yon?
Ang dextrose po is sugar. Alright. So maltodextrin is maltodextrin is a sweetener that they use then. It's also used in a lot of these diabetes formulas. Okay. So the sweeteners like aspartame, sucralose or Splenda, stevia. Okay. So these are non-caloric. They don't have calories in them. So if you want to substitute them for sugar, you can. If you want to lessen the calories that you're taking in from sugar.
Okay. Pareho lang ba yung brown sugar and white sugar?
Pareho silang sugar. So parehas din yung calories.
Ng brown sugar. Mas okay daw yun kasi related daw siya to brown rice. Totoo ba yun?
Pareho silang sugar, so pareho din yung calories na makukuha mo from them.
So, pareho rin lang.
Pareho lang.
Pareho lang. Okay.
Sugar is sugar.
Dami kong nalaman. Okay na tayo, Miss Rains?
There is one last question. This is
last.
from one of the viewer, Jonald C. Abstin. With the reduced physical activity and less calories being burned, pwede ba gawing 2 healthy meals a day na lang rather than smaller portions of 3 to 4 meals a day?
Okay. Hi, Jonald. Kilala ko yan. Friend.
Wow.
Okay. All right. So you want to lessen the two meals a day versus
2 times na lang daw siya kakain.
twice a day versus 3 to 4 times a day. That's what people who are on a time restricted feeding also do. Okay, sometimes they just eat twice a day. So whatever works for you. All right, as long as you're still having enough of the nutrients. Yun lang naman eh. Pag nagda-diet tayo, kailangan make sure you have enough nutrients in your body. So hindi magkukulang sa vitamins and minerals with whatever diet that you're on.
So, pwede naman yung 2 meals a day.
Pwede.
Malalaking plato. Hindi rin. Hindi rin. Yeah.
As long as hindi siya excess dun sa kailangan mo. Kasi anything in excess, if you take too much calories, that will turn into fat.
Doktora, may humabol po na last question.
May humabol pa raw. Last na to. Okay.
Okay, from Miss Shane Galang. Ano po ang recommended diet if you have a defect po sa diaphragm and colon? Since non-emergent surgery po ako, ano po need ko avoid and must need i-intake?
Okay, so I think you'll need a little bit more information on that. Kasi kung do you have diarrhea or what? So it it's a little bit difficult to
Mahirap sagutin. Oo.
to
Ito lang,
answer.
kung naoperahan kayo, you need to eat well and regain your strength. Weight loss, lahat yan, that can be after. Some people kasi they try to do, I mean, kung naoperahan ka talaga, get better first. And then after that, pag-usapan natin yung weight loss. Hindi siya pwedeng, sa akin that's my advice to person.
Right.
Settle the main issue muna and then we can move on after. Yan.
If it's to prevent, colon cancer or what,
Oo.
eating a high fiber diet is
Maganda. Okay. Dr. Joy, sobrang exciting itong talk na to. Though medyo nalungkot ako sa mga plano kong kainin. Lalo na since meron akong stress eating due to COVID. So, sa inyo pong lahat, thanks so much, Dr. Joy. It's such an interesting talk talaga. And I really learn so much every time that I listen to this. Especially yung ating diet talks. Kasi talagang lahat tayo tinamaan nun. So thanks so much. We are very honored to have one of the most eminent endocrinologists in the Philippines to join us to celebrate World Obesity Day last March. Thank you, Dr. Joy. Salamat. Doktora, Miss Rains, parang naputol ata si Doktora. I was going to ask her pa naman, for ano.
Thank you, Anna. Thank you.
Joy, any last words of encouragement sa mga na-depress sa talk mo? Like me. Huwag ma-depress.
Talk to your doctor and your dietitian. They can help you. They can help you with the diet. So talk to your healthcare professional, whether it's your doctor or your dietitian, para matulungan ho kayo. Magabayan kayo sa tamang pagkain.
Thank you so much, Dr. Joy.
Thank you. Thank you very much, Anna.
It's an honor talaga. One of the most eminent endocrinologists, and she's really super mabait pa. Dr. Joy Castillo Fontanilla. Very smart, noon pa man din. And now, one of the top endocrinologists. So, sa inyo po lahat, thank you so much for joining us. Ang dami po talaga. I think I missed the question on the gallbladder, yung kay Ma'am Sengson. So, let's answer parang...
Okay. From Miss Marie.
I have a patient who has a gallbladder and he's turning yellow. Kailangan pa daw ba siyang surgery? Ma'am, patingin niyo po sa doktor kasi mahirap po tayong to tell you if it's an emergency or not without seeing po the patient. And again, kung hindi po siya makapunta sa hospital, then there's always po video consultation. Kaya lang mahirap po magsalita kasi we don't see the patient. So, yun lang po. Ako ang best na kung talaga pong hindi naman humakayanan ng tao, emergency room, kung kaya naman po, video consult. Okay? From Madonna, thank you, Dr. Joy, for your info, and Dr. Anna for the live show. Thanks, Madonna. I hope you learned something. And sa inyo po lahat, magandang gabi po. And World Obesity Day, we have to be conscious of our weight. It's one of the major problems po talaga that can cause heart disease, diabetes, stroke, hypertension, lahat na may relationship po talaga sa ating weight. Unfortunately, with the modern lifestyle that we have and with the COVID lockdown na hindi pa ho nakatulong, talagang na-stress eating na po lahat ng tao, which could definitely lead to obesity and of course the problems that follow after obesity. So sana po, if you have any relatives po, friends, you yourself are worried, do watch this again. We are on YouTube, Dr. Anna York Bondoc. So maraming salamat po for joining us. Stay safe and healthy. Ingat po.